Okay. Hey everybody, I'm Sinclair Sexsmith. I'm here with Dr. Matt Goldenberg, who's up in Seattle, Washington, who's one of my oldest buddies. And when I've had a variety of questions lately, both myself and from other people asking me about the health of kink play, especially deep psychological play, and whether it is contributing to some sort of compulsion or damage, or whether it's healing your damage, or whether it's good for us or bad for us. So I was like, gosh, I wish I knew some smarty psychology stuff to talk about this. So I called my good friend Matt. So Matt, why don't you introduce yourself and talk a little about your relationship with psychology and kink in general.
Okay, great. Well, thanks for talking with me. So my name is Dr. Matt Goldenberg. I'm a licensed clinical psychologist. I practice in Seattle, Washington. I see myself personally and politically and professionally as sex positive, and it really allows me to see kinky and poly and queer folks in my practice, and to include education and affirmation about all the ways that we show and obtain desire.
Awesome. Awesome. And so it's my belief generally that no fantasy is inherently wrong, and that playing with deep psychological triggers can be sometimes incredibly healing. But what to you is the relationship between mental wellness and the practice of kink?
Yeah, so I think this is a really good question. I might want to start out by saying that I find that there are a few people who don't have some difficulty in coming to terms with their sexual identity. You know,
Mm.
we think about this a lot in the queer community, but it's been my experience in the clinical world where, boy, a lot of heterosexual and cis people have these concerns as well.
Mhm.
I would probably compare, coming out as kink or coming out as poly in comparison to maybe coming out gay or coming out queer, and that I think it's a developmental journey for a lot of people,
Mm.
uh,
Mhm.
which which would sort of beg the question of when does it ever get easier? When does it ever get less complex?
Mm.
Um, so I sort of maybe start with that just because I know that a lot of people who are listening to this, might be coming to the table with a lot of concerns about their sexuality, and I want to sort of put out there that this is not an uncommon issue by any means.
Right, whatever your sexual desires are, most people in the world struggle with accepting that. Most people, well, certainly most people in the cultures that I have knowledge of Western culture and American culture in general, regardless of whether you're kinky or whether the kinkiest thing you ever do is keep the lights on when you're having sex.
Yes. Yeah.
It's a challenge. There's a lot of challenge around that.
Right.
But do you think that there are fantasies that we shouldn't play with because they're bad for our psychological wellness? Do you think there's topics that are just too taboo and can't be played with safely? What do you think about that stuff?
Well, frankly, I guess as a psychologist, there's certain types of play that are more worrisome for me, and ways that other types of play are not.
Mm-hmm.
Since I noticed my own reaction to blood play or branding, it feels a little bit more anxious than when I hear about folks doing spanking or hair pulling or most kinds of role play.
Mm.
This might be because of like the sort of obvious level of increased danger in terms of infection or disease transmission.
Mm.
Or maybe it's the act of committing to a potentially permanent scar on the body. So in a way, I imagine that the opportunity to keep revisiting a scar and a particularly intense kink experience would be pleasing. Like when you look back on something fondly and you have that longing, or you're sort of brought back to that, uh, that experience of connection.
Mm-hmm.
Then I consider all the many more patients that I've seen create scars as a form of self-abuse. So, I think I have this investment in trying to understand, well, what was the intention and what was the experience? What was the outcome
Mm-hmm.
of that time that you use branding or blood play? Um, Maybe it's about how the act starts out, like when you begin a scene with like a sense of empowerment and curiosity and desire, and you have your want. It creates such a different picture, than the distressed person who creates permanent marks to try to relieve some suffering. It's like starting and stabilizing within a position of power. That feels very different for me. That starts
That makes a lot of sense. So the attitude that you're coming to the scene with could make a big difference in how someone could potentially view the scene as healthy or unhealthy.
Yes, yeah. And there's such a readiness factor too, for any kind of sex that I'm not sure that we can say like it's always based on age or the experience that you have, your sort of sexual resume. Um, but it really has to be much more of a moment-to-moment, person-to-person decision that should be mutual, right? So one's readiness to actually be in the heart with somebody else varies so much that I think it's hard to make a sort of statement about, oh, this kind of play is not healthy for one, but because it could be really healthy for another.
Mm-hmm. Mm-hmm. Yeah, and I guess that is part of the nuance that I'm really curious about is when I've seen, types of power play and power dynamic relationships be really unhealthy for people, and then when I've seen them, other people say, but it's really, really healing for me. And I'm curious about kind of how to know the difference between when some sort of kink that you're practicing is contributing to your own damage versus when you're healing from it, and when it's something um, that is, I don't know, quote, good for you. I know it's not as easy as being like just good for you, but
Right.
um, I'm not sure sometimes how to tell. And
Yeah.
it's certainly hard to, it's almost impossible for me to tell about what somebody else is doing. But even just for my own self, like, how do I know when what I'm doing is good for me or bad for me?
Right. Right. And it can be, I think, especially ambiguous, excuse me, right? Because like oftentimes after that scene happens, after that endorphin rush, you might have a cathartic release of tears.
Mm,
You might be rocking. You might actually
mhm,
have time alone, right? And so
mhm,
some of those things might indicate like, wow, this is actually not healthy. But indeed, it actually was just part of the process. It's almost like you're
mm,
still in the scene.
mhm. Right. You can have a little collapse after having such a high, and that might not be an indication that it was bad for you. It might just be part of the process.
Sure. I noticed that some of your readers are also asking questions about role plays, like
Mm,
especially trauma survivors,
mhm,
submissive, or like a targeted person playing the role of an agent. And by that I mean like targeted with like a political power, so
mm. So a
playing,
minority of some sort.
yeah. Yeah, and I think people can really feel a deep shame. For example, like when people want to feel this sense of power over another when they themselves have been victimized by others dominating them.
Mm,
So I think we need to be really clear that whether we're talking about direct physical violence or the oppression of a targeted group, there's absolutely no consent in that, right? There's no consent. In role-play kink, there's both the initial and the ongoing negotiation. And actually, and I'd be kind of curious to know what you think about this, Sinclair. Generally, I think that I see the dominant partner as just a shade more vulnerable than the sub,
mm,
right? Certainly both people are giving, but the dom as the person with more responsibility to facilitate the interaction has to show up emotionally and physically,
mm,
spiritually, and sexually, and psychologically, with both an empathic and a directive energy.
mm,
The abuser or the perpetrator is not concerned with holding all those domains together and with any consistency,
mm.
right? So
That's a really good point.
while I could see why some people might be a bit scared of their own desires, we really have to be honest with ourselves that there is a magnificent amount of difference in these organized forms of adult play.
Absolutely. And like you said, there's initial consent and then there's ongoing consent where you don't just get it once and then have it forever. You get it and you keep getting it and you keep getting it and you keep checking in and making sure that where you're both at is where you both want to be.
Yeah,
And that's interesting about the dominant being a shade more vulnerable. I definitely think both the dominant, the submissive, the top and the bottom hold vulnerabilities in their own ways, and they might look really, really different. One of them might feel really vulnerable one day and not as much the next. It's just kind of, I don't know how to compare them though. I mean, in terms of more or less vulnerable than the other, they're just different. I do think there's a lot of vulnerability in dominating and topping. Um, And you're right, I think part of it is holding all of those different spheres together of responsibility and what's the word, like having one foot in the real world and one foot in the scene. So you're holding the limits of the scene, you're holding the boundaries of both of you have agreed upon, you're paying attention that, you know, maybe your flogger doesn't hit the guy behind you or something.
Right.
Like you have to really be aware of your surroundings in a way that a submissive doesn't have to, and it's harder to drop in and out of the scene. Mm.
Yeah, right.
Yeah.
That's right. I mean, one of the things that you were asking is the sort of the signs that might indicate that someone is in a danger zone, right? Or
Yeah.
something they shouldn't be. And you're really pulling on the point that I was thinking about too, right? Which is that there's this distinction between actively entering the play space and then not knowing if you're still in it or in it at all,
Mm.
right? And that term play space, I mean both the actual physical environment where the act is occurring, but as well as
Mm.
that there's a sort of psychological transfer point, right, where you know that you're intentionally pulling on a fantasy to share with someone that you trust and that you identify all of your exits,
Mm.
right? Even if you're sort of
Mhm.
deep into that scene, there should always be on the, at least on the sort of back burner, you know where the exits are, you're intentional, you're awake, you're alive to that.
You know what your safe words are. You know how to get your top's attention. If you're like, okay, stop. If saying okay, stop isn't going to do it, then you know how to say red, or you know how to say banana, or you know how to say whatever it is that you need to say.
Yeah, yeah.
Right.
I do feel that there is concern for times when you no longer have that, right? Because
Mm.
both the top and the bottom in this way have some responsibility of keeping a foot in the sort of reality door,
Mm.
right?
Mhm.
When one or potentially both have lost their way in that, can become so dangerous,
Hmm.
right? So,
Well, and that's part of, when I really like to play with are things like 24/7 DS, of having this power dynamic that isn't only in the bedroom or only in the play spaces, but extends to doing the dishes or where we go on vacation or whatever kind of decision making is happening between the DS relationship outside of the bedroom. And um, and and it makes sense that it's really harder to identify this is the play and this is not, and there's fewer kind of identifiable exits, if you will. Um, and it's also true that I think responsible DS people who play with DS um, will listen to whatever concerns come up without, you know, having that be an issue. That you can have check-in times, or you can have if you can't do it in a day-to-day kind of way, to be able to have a set time that's like, okay, this is the time when we sit down and talk about, is this working or not? What are the complaints? What are the issues that we need to iron out? Because some people don't like to kind of break character to be able to have those check-ins. Um, that's not necessarily how I play. I kind of think if someone comes to me and says, hey, I want to work on this thing. Hey, there's something going on here and I feel icky. Then I'll hear that without saying, that's not submissive of you. That it matters to me that they're, both of our emotional well-being is taken deeply good care of. So there's always to me an exit, and there's that factor that we play with around, like, there's no way out, I own you forever, whatever, conversation of that kind of language.
yeah.
But I think it's different than not being able to hear when someone says, "Hey, um, I need to talk to you about this important thing."
Hmm. Right, right. And you're describing the top or a dom, even in a 20 relationship, who still carries some tenderness and some grace.
Absolutely.
Uh, that's why I feel that this is just so different from saying that you're just entering into another abusive relationship.
Mm-hmm.
There might be some truth that there are folks who are working on kind of mastering their trauma, and why not through this way,
Mm.
right? Why should we say that the only place to do that is on the couch, so to speak? Right?
Which is an important place to do it, in my opinion. I mean, as someone who's done
Yeah.
a lot of therapy in my life, the tools that I've learned there are really applicable in lots and lots of places. Um, and the you know there are it's not the only place that I've learned, and sometimes I need some somatic things too, some body work, some, breathing into it, or tools about how things move through my muscles, all of that stuff. Yeah.
Yeah.
And I think as I'm continuing to support and encourage people in these intense dynamics, um, it it can be a blurry line between, like, I want to do this, I don't want to do this, and I want to do this, but I want to please my top, or I want to be a better dominant, or I want to for a variety of reasons that, so how do I know if me wanting to do that is coming from the right place or the wrong place, or coming from my compulsions, or coming from being healed by this dynamic? That's the stuff that gets trippy for me.
Yeah. Right. Right.
Am I playing into this or not?
Yes, exactly. Yeah. I think Kink should really allow you to surprise yourself with your reactions. To the
Mm,
extent that you do learn more about yourself. You learn more about what you like and what you don't like, and what feels good and what doesn't feel good. And this feels good sometimes, but not all the time.
mm,
People I've talked to have described that in the process of coming out kink, other domains in their life seem kind of bland. Right? Like,
mm-hmm.
ooh, now I got to go back to my job, or ooh, I got to go walk the dog. I don't know.
It's so boring now. Yeah.
Yeah, and I think it's because it really can have the power to bring so many different parts of your identity alive at one time,
Mm.
right? Like it's less compartmentalized to me than maybe other processes we have, right? Because for most people, it's going to pull on childhood experiences. It's going to pull on times when we felt we weren't good enough. It's going to
Mm.
times of power. It's going to pull on role models and mentors and information.
Mm-hmm.
There's just sort of this whole storm that I see could happen in a kink setting.
Yeah, I think that's totally true. And some suddenly I'm, have an overwhelm of sensation, and I'm crying about a loss from when I was 10 or something, or suddenly I'm just completely euphoric and giddy, and I'm like, feel like I have inner superpowers that I've never experienced before, or, I can tap into my varieties of self in really more ways when I'm playing with this kind of intensity of both power and sensation. So is there anything we should really watch for, though? Like, this is a red flag, don't do this, or, really keep an eye on it when you get to this point.
Mm. Well, I would say that when when you are feeling much more fear than pleasure, that would be an indication to me that something needs to be renegotiated.
Mm-hmm.
And I guess I should add that there's a big difference between feeling anxious and feeling afraid,
Mm.
right? Because anxiety is always about things that haven't quite happened yet, right? So we're just not quite sure how we're going to react, or maybe I'm not going to be able to take this kind of paddling, or um,
Mm.
whatever. Those sort of little anxiety moments can actually be really helpful for the pleasurable experience you're about to have. Um,
Mm-hmm.
so that's different from this sort of intense silencing that fear can cause, right?
Mm.
You feel like
Mm-hmm.
in danger. And I don't know that this is always physical. I really mean like the psychological fear of like this feeling of entrapment. Um, that's what I would be probably really concerned about.
Yeah. Yeah, if someone felt like they couldn't change it, or they couldn't say anything, or their concerns weren't going to be listened to or weren't heard.
Sure, and actually, like as we talk about this, we could probably pull the lens back. This could be a conversation about what it, is consisting of a healthy relationship in general.
Mm-hmm. Totally.
Like a
Right.
lot.
If you can't leave, or you can't pursue these things that you really want to, or you're being controlled, or in a way that feels really crappy.
Yeah.
Because a lot of times DS control feels really good for people who are inside of that. But if it stops feeling good, then you're getting into a zone where you should watch what's going on and be careful. That makes total sense. Like,
Yeah.
kind of the same things about all sorts of other happy, healthy relationships.
And again, this is why I think it might be important to bring the point that like if you are having a sense of anxiety, you can bring that with you. That can have probably help catapult you into even having a closer connection, right? Because it's a little bit.
Mm,
So when we talk about like what feels good, that seems like a time to be more specific. Like what's within the good.
mm,
You could actually bring some of your anxiety with you, right? You can bring some of your shame with you. Well, I think it helps to have, of course, like come into that scene with a sense of power and curiosity, like we were talking about before. I don't know that that has to be your full palette, to
mm.
have a really good experience with.
Yeah, so if you're bringing some of your anxiety or your fear into the scene with you, or does it become a possible tool that, you could play with in a kinky way? I guess I'm thinking of like humiliation scenes even, or, you know, um, if you're very anxious about the future, then you might go into a scene where your dominant has everything planned for you and you have absolutely no idea what's coming.
Yeah.
And that might be very terrifying, and it might be a really interesting way to play with your anxiety.
Well, yeah, and to be fair, one of the most sort of celebrated and empirically validated treatments in psychotherapy for anxiety is exposure,
Mm,
right? Where you're bringing somebody directly into their fear and you're helping them breathe along the way. I mean, simply stated, I mean, maybe this is not a fair comparison to make. Maybe the whole mental health profession is going to be like, oh my God, what is this guy doing? But to me, I'm like, this is a graded way of having that similar experience. Like, there's so many ways to self-actualize.
mm,
Um, the the
mm.
personal experience of the psychologist or therapist is certainly going to be helpful. Uh, but I don't mean to suggest that I think healing relationships only happen in a therapeutic setting, right? I think healing can happen in so many different places.
Hmm. Yeah, me too. That's important.
Yeah.
Well, and I think a lot of people are really afraid to talk to their therapist about what they're doing in, kink wise, that they might not be out to their therapist as kinky. They might be able to kind of speak in general, pull the lens back ways of like, I'm feeling yucky in my relationship because I'm feeling too controlled, or I don't get enough to agency or something like that, but they might actually be having this complicated kink dynamic underneath that. um, do you have suggestions for people about navigating kink with their own therapist?
Yeah, I'm glad you brought that up because I wanted to make sure that we had some resource about that.
Cool.
There is at least one database that I'm aware of that has a listing of kink affirming therapists.
Mhm.
National, we should make sure that that's out there for folks.
Yeah,
Um,
let's put a link to that in the notes.
okay, yeah. But and I really encourage people to be informed as healthcare consumers. You do not need to stay with a therapist who's pathologizing your sexual desire or who's shaming you in any way. Right? You get to request someone who can provide better care. And since so many of your readers are queer identified as well, or like sort of in some way on the edges, uh,
Hmm.
let me just add the advice of don't spend your therapy hour having to educate your clinician about your political affiliations or your cultural identity. Therapy is expensive. The time is sacred, right? So the time on the couch should be your time. Um, if it's not being used to help move you closer to wherever you would rather be, it's time to find another person. You can certainly ask your therapist to do their homework, but if you don't see any quality differences, fire them or request to get somebody else and move on, right?
Right on.
Know that you're worth that.
Hmm. Totally.
Yeah.
And what do you think about Skype therapy? Do you often offer sessions virtually online for people?
Well, that's a great question. We're having a big debate nationally and as well as here in the state of Washington right now about telehealth, which is the sort of legal term for this.
Okay.
Um, the managed care industry is not that interested in supporting this
Mm.
point. Um, I guess there's a lot of concerns with that. I personally will do Skype therapy with certain individuals. For me, I prefer to meet that person in person at least once in the beginning, but because there are maybe not as many healthcare professionals as there needs to be to serve a pretty diverse community, I will see people over Skype. There's certain restrictions. I have people sign a policy waiver. I use a HIPAA compliant electronic software for those purposes. So it
Oh,
works like
cool.
Skype, but it's not Skype. It's actually a secure site. There's many benefits to being able to do it.
Yeah.
But unfortunately, because the managed care industry is not behind it, we're not able to bill insurance for those sessions.
Oh, interesting.
Right? So for a lot of people, it becomes financially impossible.
Yeah. Yeah, that wouldn't be possible for me, for example. It's hard. Therapy's expensive.
Yeah, yeah, it is. It is.
It's interesting though, and if you really do want to delve into the psychology of, your kinky life or your queer and genderqueer stuff, your transition or your whatever you're going through that's all intense, sometimes it's really hard to find a good therapist who's familiar enough with those communities that you also aren't maybe running into them at the play parties on Friday nights, because that's a challenge too. When the kink worlds are really small, you don't necessarily want to be going to the same parties as your therapist is going to.
Yes. Yeah, that's a good point. We always run the risk of having multiple relationships. When you're both in a marginalized population and serve that marginalized
Mm,
population.
good
Um,
point.
but I mean, I'm of course videotaping this from Seattle. You're in the Bay Area. We're in these areas that are so rich with community that
Hmm.
even though that's a possibility, it's not as strong as it's going to be like rural Montana, a college campus.
Right.
Um,
Right.
that,
There can be a lot more isolation.
yeah. So um, I think it's great for potential clients to be aware of this, and the therapist or the psychologist or whoever the health professional is has the responsibility of keeping your confidentiality way more than the client does. Like as you come into therapy, you get to say whatever you want about what was said, right? It's not your end of the bargain to hold up. It's the It's the healthcare provider's responsibility to remove themselves from any situations that might
Mm.
complicate your confidentiality, or at least complicate the roles that you each play in the room.
Mm. Got it.
So this is why it's so important for people to be informed about this when they're getting healthcare. If you don't notice, if you notice that your professional is in a lot of your community is not working hard to protect you in that, something's wrong
Mm. Mm-hmm.
from my perspective.
Got it. Yeah, that totally makes sense to me. And it seems like it's something that the psychologists that I know are very aware of and concerned about, holding their identities privately if they're contributing to things online, or being aware of what they can and can't participate in person in events.
Yeah,
Makes sense.
yeah. When people start with me, I have one of the registration forms that I have is actually a social media policy, right? So
Mm,
before we even meet,
right.
if I see you on Tumblr or FetLife or Facebook or even out in the community, I will remove myself from that interaction. And here's why, right? Because I respect
Mm-hmm.
your confidentiality is important. I want you to have that space. I'll make accommodations in my own life to make sure
Mm-hmm.
my stuff is met, and it doesn't take up any of your time,
Mm-hmm.
right?
Mm-hmm.
That should be a discussion that's easy and accessible and direct.
Yeah, that makes sense.
Yeah.
That's great. Is there anything else about kink in particular, or the health, psychological health, and playing with kink stuff that you want to leave us with as we're pondering?
Hmm. Well, I guess maybe just an encouragement for folks who are listening and reading this, just to keep talking to each other.
Awesome.
You know, there's it, of course there's going to be, because I do think this is a developmental journey for a lot of people. There will be ups and downs and times in your life when it's a little bit harder to sit with your desires and who you are, and other times when it comes really easily.
Mm.
Right?
Mm-hmm.
I think finding a lot of support and encouragement, especially in the times of the hard, is important. Right? So I think as long as I
Wow.
keep working and you keep working, and or and the many many other people who can offer affirmations. For folks who are going through this kind of discovery, keep doing what we're supposed to be doing. There should be plenty of care for everybody, right?
Absolutely. Yeah, yeah. There are a lot of people doing amazing support around these developments and kind of coming into being of these in these categories. So, which I'm really grateful for, and which have been instrumental to my own sense of self and wellness and psychology, and then also awesome kink life. It's been I have not gotten here alone for sure. I'm
Yeah.
very grateful to many of my teachers and peers and friends and community.
Well, yeah, and it's a great example, having been been your friend for like a decade.
Yeah, at least.
I think we've been friends somewhere a decade or a bit over. I can speak to at least witnessing your journey and how different you are. Not just
Mm.
like the events that have happened in your life, the losses and the gains and the many moves across the country. Not just that, but what it has meant for you, bringing this sort of authentic piece of your identity out, your
Mm.
deal with hard emotions and
Mhm.
hard places, and to grow in your compassion.
Mm.
I mean,
Mhm.
it's changed who you are, and I feel pretty confident that, like, given the right amount of support and structure, you could have the same outcome with lots and lots of people, right? Like
Yeah.
pink and leather and poly and queer communities.
Absolutely. Right, and the support is there. We just sometimes we have to reach for it or sift through the crappy stuff, which is sometimes really exhausting, but it is there if we keep looking.
Yeah,
I do trust that.
yeah, absolutely.
Aw, thanks, Maddie. It's
Yeah,
really good to talk to you, and thanks for the kink and psychology advice. I appreciate it, and I'm really grateful to have you as a resource where I can ponder my personal musings about this stuff. And I'm excited about the little interview, so I'll let you know how that evolves.
thank
Gets
you
when
so
it gets
much.
online.
Yeah, thanks for
Thanks.
inviting me. It was great talking with you.
You bet. It's great to see you.